Today, cancer causes 1 in every 7 deaths worldwide. But how does cancer start and what is being done to combat it? Our body contains trillions of highly specialized cells and each carries genes responsible for regulating growth and division. But when a genetic change disrupts this process, cells begin to grow and divide uncontrollably, thereby becoming cancer. The genetic changes that cause cancer usually happen in 3 types of genes: proto-oncogenes, which signal a cell to grow and divide, tumor suppressor genes, which signal a cell to stop dividing, and DNA repair genes, which preserve and maintain genetic codes. Changes in these genes lead to abnormal cell growth, resulting in masses of tissues called tumors. Tumors may be benign, meaning that they remain in one area, or malignant, which means that they are capable of spreading. Through a process called metastasis, a malignant tumor cells will eventually break off, travel through the body, and begin forming tumors in other regions. When this happens, the cancer has become metastatic and is most dangerous. The cause of cancer is still a mystery. Inherited traits may be behind some of the genetic changes that lead to the formation of cancer cells. And so might environmental exposures, such as excessive radiation from the sun or chemicals in cigarette smoke. In the United States today, roughly 1/3 of all people will eventually develop cancer. Of the over 100 different types of cancer, breast cancer is currently the most prevalent type, and the lung cancer causes the most deaths. But our ability to fight cancer is improving. Since just the 1990s, cancer mortality rates have been dropped more than 26% in the US, and more than 2 million lives have been saved. As treatments and methods of early detection improve, and doctors, scientists, and the public better understand cancer, hope remains in the fight against the disease.
സ്നേഹമുള്ളവരെ, ഇന്ന് ഫെബ്രുവരി 4 ലോക ക്യാൻസർ ദിനമായി ആചരിക്കുക. ക്യാൻസർ രോഗികളുടെ എണ്ണം വർദ്ധിക്കുന്നതും മരണസംഖ്യ കൂടുന്നതാണ് ക്യാൻസർ എന്ന രോഗത്തെ ഏറ്റവും ഭയാനകമാക്കി മാറ്റുന്നു. ക്യാൻസർ എന്നാൽ ജീവിതത്തിൻ്റെയോ സ്വപ്നങ്ങളുടെ അവസാനതല. 50% ഒരു ക്യാൻസറും ചികിത്സിച്ച് ഭേദമാക്കാവുന്നതേയും. അതുകൊണ്ടാണ് ക്യാൻസർ രോഗത്തെക്കുറിച്ചുള്ള അവബോധം ജനങ്ങളിൽ വളർത്തുവാൻ ക്യാൻസർ എന്ന രോഗത്തെ ആവശ്യമായ പരിശോധനകളിലൂടെ മുൻകൂട്ടി കണ്ടെത്തുന്നത്, രോഗപ്രതിരോധ പ്രവർത്തനങ്ങളെ പ്രോത്സാഹിപ്പിക്കുന്നത്, ചികിത്സാ സംവിധാനങ്ങൾ ശക്തിപ്പെടുത്തുന്നതിനും ലക്ഷ്യമാക്കിക്കൊണ്ട് ലോകാരോഗ്യ സംഘടന ലോക ക്യാൻസർ ദിനം ആചരിക്കുന്നു. സാമൂഹിക, സാമ്പത്തിക, സാംസ്കാരിക ചുറ്റുപാടുകളിലേക്ക് ഇറങ്ങിച്ചെന്ന് രോഗത്തിനനുസൃതമായ സത്വരമായ കെയർ, ശ്രദ്ധ ലഭിക്കാതിരിക്കാനുള്ള ഗ്യാപ്പ്, തടസ്സങ്ങൾ എന്തൊക്കെയാണെന്ന് കണ്ടെത്തി പരിഹരിക്കാൻ വേണ്ടിയിട്ടാണ് ഈ വർഷം ലോക ക്യാൻസർ ദിനം നമ്മോട് ആവശ്യപ്പെടുന്നത്. അങ്ങനെ ക്യാൻസർ രഹിതമായ ഒരു ഭാവി, മെച്ചപ്പെട്ട ആരോഗ്യ സേവനങ്ങൾ നൽകാൻ കഴിയുന്ന ഒരു സാമൂഹിക പരിസ്ഥിതി സംജാതമാക്കാൻ ഈ ബോധവൽക്കരണ പ്രവർത്തനങ്ങളിലൂടെ, അല്ലെങ്കിൽ ബോധവൽക്കരണത്തോടനുബന്ധിച്ചുള്ള തുടർ പ്രവർത്തനങ്ങളിലൂടെ നമുക്ക് സാധിക്കേണ്ടിയിരിക്കുന്നു. പ്രത്യേകിച്ചും രോഗം വരുത്തിയിരിക്കുന്നതിനേക്കാൾ നല്ലത് രോഗം വരാതെ നോക്കുക. ഔഷധശാസ്ത്രത്തിൽ ഡിഗ്രി സമ്പാദിച്ച് ആരോഗ്യ പ്രവർത്തകരായിട്ട് മുന്നേറാൻ ആഗ്രഹിക്കുന്ന നമ്മെ സംബന്ധിച്ചിടത്തോളം മാതൃകാപരമായ ഒരു ജീവിതശൈലി, നല്ല ആഹാര ശീലങ്ങൾ പിന്തുടരാനായിട്ട് നമുക്ക് സാധിക്കണം. വ്യായാമശീലങ്ങൾ കൈവരിക്കാനായിട്ട് നമ്മുടെ ജീവിതത്തിൽ നമുക്ക് ശ്രദ്ധ കൊടുക്കേണ്ടിയിരിക്കുന്നു. ലഹരി പദാർത്ഥങ്ങളെ ഏത് വിധവും വർജിക്കാനായിട്ടുള്ള തീരുമാനമെടുത്ത് അങ്ങ് ക്യാൻസർ ഇല്ലാത്ത ഒരു ലോകത്ത് ജീവിക്കുവാനായിട്ട് നമുക്ക് സാധിക്കട്ടെ. ഈ ദിനാചരണത്തിന് ബോധവൽക്കരണ പരിപാടികളുമായിട്ട് മുന്നേറുന്ന ഈ കോളേജിലെ 2ാം വർഷ ഫാം ഡി വിദ്യാർത്ഥികളെ പ്രത്യേകമായിട്ട് ഞാൻ അഭിനന്ദിക്കുകയാണ്. എല്ലാ പ്രവർത്തനങ്ങൾക്കും വിജയം ആശംസിക്കുന്നു. ദൈവാനുഗ്രഹം പ്രാർത്ഥിക്കുന്നു.
Arun Warier, Concept Medical Oncologist at Aster Medicity coaching. World Cancer Day wishes to all the Pharm D students at Nirmala College, Mathew. So this year, the World Cancer Day as usual is on February 4th. The theme of this year is Close the Care Gap. So this is a very important theme because all of us are involved in care for cancer patients. So we have to make sure that they get the best care. So I think for a cancer patient, it is not just the treatment that matters. There are a lot of other issues also. Like people are still worried about cancer. They still have the fear of cancer. So the gap for a correct management starts from there itself. Even if a person has got symptoms of cancer, it can be a lump anywhere, it can be unusual bleeding, it can be a cough or breathing difficulty which is persistent for weeks together. Still they are worried to come to a doctor or to seek medical attention because they fear that they may have cancer, and this undue fear itself is the first gap which prevents the diagnosis of cancer at an early stage. So, as part of the community and society, we all of us have this responsibility that this fear is not there among the public, and they will seek medical attention at the earliest. So, as students, you should do that. You should try to educate that cancer is not something which has to be feared, and we should not fear the disease or the treatment, but we should the fear should be about late diagnosis, which can have an impact on the outcomes also. So that's the first thing about coming to medical attention. The second gap which we have seen is patients don't have the required facilities for that. Like they may have financial issues to seek help, but still all these things are not very relevant. We do have very good hospitals in the government sector, or affordable healthcare is still there. So we have to give them the correct guidance where to go and where to get the correct diagnosis, and then to plan the treatment. Now the third part is about the medical care. So I think the medical care is also very relevant because in a cancer treatment, they may be subjected to various treatments like surgery, radiation, chemotherapy, which are all very complicated treatments. So we have to make sure that the patients get the correct treatment. So ideally, this should be in a comprehensive cancer center. There should be a multidisciplinary team of doctors, which includes the specialties which I told before. There should be a good radiologist who will be able to do the scans, and they should be able to take a biopsy. There should be a pathologist who will be able to read the slides and give us what is the correct type of cancer. Then they should have a team of medical, surgical, and radiation oncologists. Ideally, they should speak to all of them before starting on any treatment, because sometimes, like in the most common cancer of the breast, in some cases we can do the surgery first. In some cases, we can do the chemo and reduce the size and make sure that they get the correct surgery done. So they should be able to speak to all the specialists who are involved in cancer care. And if sometimes if one team they may not be very clear with that, then we also tell them to take a second opinion, because all of us follow certain protocols. So I think that also we have to understand that cancer treatment is not decided by a person or a hospital. All of these are multicentric trials have been done, and there are protocols which are made and which are followed. So as pharmacists, you may be aware of these protocols. Like for each cancer, for each stage, we have specified drugs are there, and there are specified dosages are there. And the job of an oncologist is to prescribe the drugs and to make sure they are getting the correct drugs, and we have to manage the toxicities. So that is one important factor. And again, as pharmacists, you may come across cancer patients. So it is not just the cancer drugs which are important. As a cancer patient can have various other problems also, like somebody who is already having diabetes, it can get worsened because of cancer. They may not be able to take the food properly, so they may go to hypoglycemia. The BP status can vary. They are more prone for infection. So I think all these are important. So that is where the job of an oncology pharmacist is very challenging, because they have to make sure that all the medications which the patient is getting is being correctly titrated, the correct doses are given, and because their body is subject to constant changes because of the treatment, the immunosuppressions of chemotherapy and all, we may have to modify these things also. So when you graduate and become a qualified pharmacist, you will be exposed to these things in more detail, and you must ensure that even a cancer patient you come across, try to understand that it's not just the chemo drugs which are important, but all the other drugs which the patient is getting also has to be closely monitored. So this is again each small step which each of us can do, so that we are again reducing the care gap for the patient. And this is very important to make sure that the patient is completely cured of cancer. So again, thanks for giving this opportunity, and wishing all of you a bright future. Thank you.
Good morning to my dear, my dear friends as well as my dear students. I've been invited to share a few message on this World Cancer Day as a part of a video making process. This World Cancer Day, we recognize the power of knowledge. We know that the ability to make a difference, large or small, and that together we can make real progress in reducing the global impact of cancer. This February 4th, we call on you, whoever, wherever you are, to play your part in creating a cancer-free world. This World Cancer Day for the year 2022 to 2024, the theme is announced that close the care gap. So by this message, I sincerely appreciate the second Pharm D students who have taken the clean initiatives to prepare such a video making messages to circulate for the common man and the general public. Thank you very much.
Cancer Day 2022-2024 theme, Close the Care Gap. This World Cancer Day, we recognize the power of knowledge. We know that every single one of us has the ability to make a difference, large or small, and that together we can make real progress in reducing the global impact of cancer. This 4th February, we call on you, whoever and wherever you are, to play your part in creating a cancer-free world. This World Cancer Day, what will you learn about the gap in cancer care? A 3-year campaign for impact. World Cancer Day is more than a day on the calendar. That's why our campaign is built to inspire change and mobilize action long after the day itself. A multi-year campaign means more exposure and engagement, more opportunities to build global awareness, and ultimately more impact.
2022 Realizing the Problem. The first year of the Close the Care Gap campaign is all about understanding and recognizing the inequities in cancer care around the globe. It's about having an open mind, challenging assumptions, and looking at the hard facts. Inequity in cancer care costs lives. People who seek cancer care hit barriers at every turn. Income, education, location, discrimination based on ethnicity, gender, sexual orientation, age, disability, and lifestyle are just a few of the factors that can negatively. These barriers are not set in stone, they can be changed. This is the year to question the status quo and help reduce stigma, to listen to the perspectives of the people living with cancer in their communities, and let those live experiences guide our thoughts and actions. That's how we can begin to imagine a better way of doing things and to build a fairer vision of the future, a future where people live healthier lives and have better access to health and cancer services, no matter where they are born, grow, age, work, or live. This World Cancer Day, what will you learn about the gaps in cancer care?
In all things, you have to take a risk if you want to win, to get a remission or recover with the best quality of life. Just the willingness to take a risk seems to generate hope and a positive atmosphere in which the components of the will to live are enhanced. There are many other ways of strengthening the will to live. Getting involved. The best thing a patient can do to strengthen the will to live is to get involved as an active participant in combating his or her disease. When patients approach their disease in an aggressive fighting posture, they are no longer helpless victims. Instead, they become active partners with their medical support team in the fight for improvement, remission, or cure. This partnership must be based on honesty, open communication, shared responsibility, and education about the nature of disease, therapy options, and rehabilitation. The result of this partnership is an increased ability to cope that in turn nourishes the will to live.
helping and sharing with others. A way to strengthen this partnership is to extend the relationship to others. The emotional experience of sharing and enjoying your family and partnerships supports your love for life and your will to survive. As you make the transition from helpless victim to activist, one of the most important realizations is that you have everything to do with how others perceive you and treat you. If you can accept your condition and hold self pity at bay, others won't feel sorry for you. If you can discuss your disease and medical therapy in a matter of fact manner, they'll respond in kind without fear or awkwardness. You are in charge. You can subtly and gently put your family, friends, and co workers at ease by being frank about what you want to talk about or not what you don't want to talk about. By being explicit about whether and when you want their help. Sharing your life with others and receiving aid or support from friends and family will improve your ability to cope and help you fight for your life. A person who is lonely or alone often feels like a helpless victim. There is a need to share your own problems, but helping others find solution to or cope better with the problems of daily living gives strength to both the giver and the receiver. There are few more satisfying experiences in life than helping a person in need. Patients can also take part in physiological support programs either through private counseling or through group therapy. Sharing frustration with others in similar circumstances often relieves the sense of isolation, terror, and despair cancer patients often feel. Those who must live with cancer can live to the maximum of their capacity by living in the present and not the past, setting realistic goals and being willing to compromise, regaining control of their lives and maintaining a sense of independence and self esteem, trying to resolve negative emotions and depression by actively doing things to help themselves and others in end, following an improved diet and exercising regularly.
Warm greetings to one and all, respected dignities and all my dear friends. Today, February 4th, 2022 is being observed as World Cancer Day with the theme Close the Care Gap. The main aim to observe World Cancer Day is to reduce misconception about cancer and to help patients getting the right information about it. This World Cancer Day, we recognize the power of knowledge. We know that every one of us has the ability to make a difference, large or small, and that together we can make a real progress in reducing the global impact of cancer. I would like to thank Sharon and Baiju for their introductory speech. Next, I would like to express my sincere and humble gratitude towards our administrator, Rev.Fr. Mathai Mailadiath, and Principal Badmanaban R for their valuable words. Also, I would like to thank Dr.Arun R. Warier, Senior Consultant, Medical Department of Oncology, Aster Medicity, for giving such a wonderful message on this World Cancer Day. I'm conveying my gratitude to Sneha Susan Samuel and Shane Sojan for their narration. Also, I would like to thank the Program Coordinating Committee of Nirmala College of Pharmacy for believing us and giving such an opportunity to conduct this program. Last but not the least, I would like to thank the students of second year Pharm D for their cooperation in conducting this program. Before I conclude, let me say, on this World Cancer Day, let us all unite and stand against cancer. Let's make fighting against cancer an important thing. Thank you.